Good morning, Dr. Reyes. Let's talk about flexibility when you're using GLP-1 agonists, right? So if you're on Wegovy or Zepbound or Majaro or Ozempic, this is what I teach my patients. Look, if you are running out of energy during your workouts, which is good because that means you're working out, that's the first sign that your carbs are going a little bit low. So I teach my patients to add additional days between injections. Yes, I know that may not be FDA approved to do what I'm doing, but that's what you call the management of this medication, and that's the nice things when you have a physician on board who understands this medication. So, and then let's say you get a little tubby and you added a little bit of fatness to the belly, then you bring it back to every 7 days. Now keep in mind, this is for my patients who are already in the maintenance phase. I call it the seesaw effect. So if you're getting a lot of exercise, resistance training especially, and you're doing a bunch of cardio, then you don't need as much GLP-1 because you actually need more carbs to fuel those exercise. But let's say there's a period of time, you go through 2 weeks, you could not get in your workouts and your weight went up a little bit, you're a little bit tubbier. That's why I've called myself the Tubby Doc. Then you bring your dose back, you bring the frequency of the dose back to every 7 days. I teach my patients it's more of a balance, not a balance of flexibility. Sometimes you need more, sometimes you need less. So it goes up and down, and it's never set because we have variable lives. So we will need a variety or some variation in the dosing of the GLP-1. That's how I coach my patients to do this right. And that's why they've been doing well for 4 or 5 years. Tubby Doc out.